And welcome back. Well, a migraine is the second most common cause of missing work, and it's no wonder because of the severe throbbing that it can cause, and it lasts for hours, sometimes even days. It lays people flat on the couch.
It sure does. I know this pain. And today we introduce you to the first walk-in headache urgent care center in the entire country. Hart is the CEO of Mind Neurology, has more on different types of headaches and what their clinic can do for you. It's always great to see you.
So glad to be back.
Because my heart goes out to every single person out there who suffers from headache pain, because I've had headaches since high school, as we've talked about many times. But I mean, it's debilitating. It's kind of depressing. I think it isolates people. I mean, I just want to make sure we address the fact that it really affects people's lives.
Yeah, it's a big deal. And once you start to feel like a sense of relief and be able to kind of get on a path to get better, it's pretty great.
Yeah.
You know?
Yes, life changing.
Yeah, absolutely.
I think most people think there is no path to relief. They've just survived it for so long. And to hear that there's 150 types of headaches, that was a shock, I think.
And so,
yes.
Yeah, and you mentioned not everybody feels like there potentially is actually a path. One of the reasons is there's over 150 different types of headaches, right? So it's very complex to diagnose. Less than 5% of people who suffer actually get a correct diagnosis and get put on an appropriate treatment plan. And so when you have such a low success rate, so that's 9 out of 10 people try to find an answer and don't get it, you give up.
They totally give up.
Yeah, and so that's what we're solving for.
Yeah.
This is what we're solving.
Yeah, you specialize in it.
Yes.
Yep.
I can't believe there are 150 different types. So so migraines are obviously included, but within even just the migraine category, there's a lot of different subsets.
Exactly. So headache is basically any pain of the head. It includes facial pain. Some people suffer with TMJ pain. Or dystonia. It's actually kind of the upper part of the neck.
And that's all included in what you do?
Yeah, and so we help all of those conditions. Basically, any pain that you're having from here on up, we solve for. And so with the 150 different types, you have primary headache, you have secondary headache. Primary is your tension headaches, it's the most common, and then you have migraine, which you're very familiar with. And then secondary is headache when it's caused by dehydration, right? You have head pain because you haven't drinking enough water, or you have sinus issues and that's causing head pain. So that's where your headache's caused by something else, which is still important to solve for, but that's where we can give you that answer to be like, this is the diagnosis, and then you know exactly what you're solving for, which is the pivotal foundation that you need to be able to get you better, but also do it fast, and that's the point.
So we're seeing part of your office as well, and just kind of before we were seeing some of the things that you guys have and offer, and looking at different imagery. What is the Mind Plus system? Because this is really the backbone of what you're doing.
Yeah, so at Mind Plus, we have something called Strive for 5. It's our commitment to patients to get them to less than 5 headaches per month and getting them there in less than 5 months. To do that, we have a proven system approach that we take, and that's why we're here today talking about the first part of that system is precise diagnosis, right? That's the foundation. And then we also have preventative treatment that we offer. That's a second key important piece. We have our neurointegrative therapy, and then we have our walk-in headache urgent care. This system comes together with a very specific approach for patients, which if a patient follows it with us, we will get them to that goal and get them there faster than anywhere else that you can go.
Incredible. Is the neurointegrative part and the prevention part, is that where you work with say an occupational or physical therapist kind of thing?
Yeah, absolutely. So it's not just about medicinal solutions, but also musculoskeletal. When you start talking about probably a third of patients that experience migraine or tension headache, a lot of it is sourced from neck pain, and that's where a physical therapist, along with other measures, where we can come in and set you up so that it prevents that from triggering it in the first place, which then impacts how often you get a headache, how bad is it when it happens, and then ultimately gets it under control in combination of these other things, so that you get to where you want to be, which is as little head pain as possible.
I think it's all incredible. Who are the doctors that you have? Because I think we only have about a minute left. I want you to really kind of explain, because this is a big part of what you do.
Yeah, so the precise diagnosis, it comes from our providers. So we have Dr. Bubeltz, who trained at the Mayo Clinic. He's a double board certified headache neurologist.
Yeah.
Super specific. It's all he does. It's what he's trained his whole life to do. And then we have Gable Holderness, who's been practicing headache medicine for almost 10 years.
Wow.
All she does. And when you have that focus and that experience, we've seen it all. We've seen all types of headache. Patients will still ask, do you treat this type of headache or that type? Yeah, everything. Everything.
We ran out of time, but I want to say two things really quickly. One is that you do take insurance.
Yes.
This is huge for a lot of people.
Not only do we take it, but we are in network with almost every provider
That's
out
huge.
there.
That's huge.
So care is affordable.
The other thing is we didn't get a chance to talk about it today. We ran out of time, but the urgent care walk-in clinic, first in the country of its kind, important for people to know when they have that severe head pain or head pain that won't let up.
When you don't want to leave home, you can and get relief.
Yes.
Yeah, exactly. And and when you combine that with everything else that we offer, that's how you get to success as fast as possible. And we'll be back to talk about, let's just talk about the headache urgent care here sometime soon in the future.
Let's do it.
Yeah.
I like
Aaron,
it.
love it. I
Always
was even
great to
referred
see
to you
you.
for
Yeah,
vertigo.
thanks.
So I
Yes.
mean, there's everything, all these things that you do.
Yes, wonderful team of doctors and professionals. And if you want more information or you need to see a double board certified headache neurologist, and remember, getting an appointment with those types of specialists can take many, many months at other doctors' offices. Be sure to call the main number here at Mind Plus Neurology. The number is 888-585-7975, or you can visit online at mindplusclinic.com.
Get in right away.